Over the years, mental health research has shown us that our mental health affects and is affected by our socioeconomic conditions, our financial stability, the education that we have received, the safety of our surroundings, and many more. But this knowledge is not only useful to describe the problem and how it came about. We can use it to find better solutions targeting both mental health and socioeconomic inequalities worldwide. At MQ, we are passionate about using research to find solutions that work in real life and ensure that mental health conditions are better prevented, detected, and treated, and more people around the world can live happier and healthier lives. To explore the links between mental health and each of these areas, we will use the Sustainable Development Goals, or SDGs for short. Crick, could you tell us a little bit about yourself and your work?
So my name is Crick Lund. I'm a professor of global mental health at King's College London.
Crick, what are the Sustainable Development Goals?
So the Sustainable Development Goals are internationally agreed targets for social and economic development, developed by the United Nations through a consensus building process and first launched in 2015, and they provide a set of measurable targets from 2015 through to 2030. There are 17 Sustainable Development Goals, and for each goal there's a set of targets and indicators. And the really exciting thing about the Sustainable Development Goals is that for the first time mental health has been included. The social and economic determinants of mental health are also actually targets for many other SDGs. So for example, targets around zero hunger, reducing gender-based violence. If these were to be attained, they would have huge mental health impacts at a population level. And that's why it's so important that we track not only the mental health related goals, but also try and track some of these upstream interventions which could address population level mental health.
My name is Emily Collins-Ellis. I'm the CEO of IG Advisors. My background in mental health is a really long one. My academic background is in psychology, so I studied that at university. I have personal lived experience of mental health issues, and I've also been a carer for someone with an eating disorder, so these issues are really close to my heart as well as my career. In my opinion, mental health is one of those issues that just undercuts everything else that we're trying to achieve. It's so central to what it takes to have a healthy, flourishing human society and economy, and it's also so central to the things that can undercut that and really cause damage or create problems. So for me, it's just one of those cross-cutting things that's important to every SDG, to every kind of element of how we support development. So I think as well as protecting ourselves from the negative consequences of mental ill health and the way that that can interrelate with socioeconomic development, we need to think about the opportunities that come from really investing in this and understanding it and making it a priority as part of all of our kind of policy making and all of our work, because it is the thing that will hold back education, it's the thing that will hold back health, it's the thing that will hold back our productivity as a society. And so it's just an obvious thing to focus on from my perspective.
Could you explain to us a little bit more about the links between mental health and socioeconomic development?
So socioeconomic development is incredibly important for mental health, especially at a population level. We published a large systematic review back in 2010 in which we looked at the associations between poverty and common mental disorders like depression, anxiety, somatoform disorders. And of the 76 community-based studies that we included in that review, there was a very consistent trend that living in worse circumstances of poverty is worse for your mental health. In other words, poverty was strongly associated with not only increased prevalence of depression and anxiety, but also longer course, worse outcome. We know less about the mechanisms by which socioeconomic development gets under the skin or into the neural pathways of the brain, but some of the mechanisms we do know about are that living in adverse social and economic circumstances means you're more exposed to adverse life events, especially early in life, and that's why socioeconomic development is so important for mental health, because if we can improve social and economic circumstances, again, we have potential for population level impacts.
Obviously, we know that poor mental health can have negative socioeconomic consequences at the population level, but it can also interact really positively, right? If you have an economy that's set up with a social foundation that protects that just space, safe and just place for humans, as donut economics would put it, you can end up with really positive impacts on people's mental health, their ability to create, their ability to engage with others and be in community. And similarly, if you have a population that has access to the support and the treatment that they need for any mental illness, then they can be really full participants in a society and an economy that also also then leads to positive development.
From a negative point of view, living with a mental health condition means you're more likely to have negative beliefs about yourself and about your future. And you're more likely to discount future rewards for more immediate rewards. And that has an impact on your economic behavior, for example, your capacity to save. So we've done some analysis of longitudinal data sets in South Africa looking at this bidirectional relationship, or what we call a cyclical relationship between poverty and mental health. So it's really interesting. At a population level, it's creating this kind of churn effect which maintains people in cycles of poverty and worse mental health over time.
And does this evidence come from low and middle income countries, high income countries, both?
Yeah, so that evidence is really coming from both high income and low and middle income countries. We definitely have a lot more data from high income countries. We have a lot larger cohort studies, which is really what we need, is we need to be able to track populations over time to look at these trends across the life course. But I think things are also shifting in low and middle income countries. There's increasing evidence. And I think what's interesting is that increasingly economists are including mental health measures in some of their panel data, their cohort studies, which is a huge advantage. The big challenge, of course, in many low and middle income countries is making sure that mental health measures are culturally adapted and validated, so that they're measuring what we think they're measuring, and often that process is not undertaken as rigorously as it could.
Craig, can we solve poverty through mental health interventions?
Yeah, so I don't think we can solve poverty just with mental health interventions, but I don't think we can solve poverty without mental health interventions. I think we need both. And increasingly, I think there's evidence that these cycles can be broken. So we're involved in quite an exciting study at the moment called the ALIVE study. It's funded by the Wellcome Trust. And we're looking at combining a poverty reduction intervention, which includes cash transfers and financial education, together with a mental health intervention focused on strengthening self-regulation skills in adolescents. It's a 4-arm pilot trial, so that the first arm is an economic intervention to reduce poverty. The second is to strengthen self-regulation. And then the third arm is to combine the two. And the fourth is a control arm. And so we have the opportunity to follow these adolescents over time, 6 months at the end of the intervention, and then at 12 months and 18 months, to look at the incidence of depression and anxiety. In other words, the number of new cases. And we're working in Colombia, in South Africa, and in Nepal. So it's been fascinating because they are very diverse cultural settings, but we found a lot of commonalities in terms of adolescents' experience of poverty and the kinds of opportunities there are for intervening, both to address poverty, but also to try and strengthen mental health and build resilience. And I think that's a really exciting aspect of the work going forward, is to work in a much more interdisciplinary way, bringing economists together with neuropsychologists and public health people and epidemiologists to really think about how can we adopt a multi-pronged or multifaceted approach to these interventions.
And what is the role of mental health research in advancing the socio-economic development goals?
Yeah, so I think research has an absolutely pivotal role, and I think some of the key gaps in our knowledge are around the mechanisms by which poverty gets under the skin or into the neural pathways of the brain, and in turn how we could potentially leverage some of those mechanisms to build resilience and to strengthen mental health in the context of adversity, to try and break the cycle of poverty and mental health. So we need more intervention studies, but we need smart intervention studies that target some of these mechanisms and actually measure some of the mediation pathways by which our intervention leads to a mental health improvement. So some of these mediation pathways may be neuropsychological, some of them may be economic, and so we need to be aware of both of those and include those in our studies. The other huge area where we need more research is in terms of longitudinal epidemiological studies, especially in low and middle income countries and especially in sub-Saharan Africa. And that's certainly an area for development, I think, for all of us.
And what would you say are key success factors to collaborating effectively and advance the Sustainable Development Goals?
I think the biggest success factors for collaboration towards impact, especially when you consider the SDGs as a framework, is about thinking about our work in an ecosystem, right? Really embodying the spirit of the SDGs, which is we're all in this together, but we also all have to work together to create the impact and the change that we want to see. And when you think in an ecosystem way rather than a commercially minded or a market-driven way, it opens up a lot more opportunities for thinking about how we relate to one another and how we work in collaboration. A big part of that is not being in competition, whether it's with other nonprofits or other funders or other nations even. It's also about thinking about how we embody trust and empathy and how we recognize the humanity of all the people who are involved in the collaboration, even when we're representing big and complicated organizations. And then looking at the ecosystem, we really need the infrastructure of that ecosystem to be supporting the work that's happening. So thinking about data, there's so many things where we don't even have data on how we're doing against the indicator of the SDG, never mind, the progress we're making. And there's a lot of other kind of learning, experimentation and research work that needs to go into the process of achieving the SDGs even before we get to action on some of those indicators. So investing in the data and learning that's required to know how we're doing and then where we need to go is a really key part of that. And then the final thing is around how we coordinate our actions. A lot of collaboration is about knowing what other people are doing and coordinating accordingly. That might be aligning what you're doing with them, or it might be doing something else because you can see that you can add value elsewhere. And so the investment in the time that it takes, the relationships that it takes to build those partnerships and understand each other's work and work in concert with each other within that ecosystem, almost kind of build the coral reef that the ecosystem needs to thrive. That's what is really, really important. And I think that's where philanthropy in particular can play a big role, because public funding will always need to focus on the most proven kind of tangible impact, but philanthropy can provide that kind of backbone support to the more kind of risky learning-based approaches. So that's one reason that we believe that philanthropy has that catalytic role to play.
Which recommendations would you have for mental health research organizations such as NQ to advance in these more integrated approaches to mental health and development?
Yeah, trauma-centered, I think, is, especially from my background in human rights, that's where that really comes from, is an understanding of the social consequences of not supporting entire populations to integrate conflict, to integrate crisis, to integrate things that are happening at the geopolitical level that really affect their day-to-day lives. And then obviously systemic marginalization, like for queer communities and for people of color and for religious minorities, not considering that when considering why mental health challenges might be more prevalent in certain communities. I think that's something that's really important as a lens to apply to any research agenda within mental health.
From a policy perspective, I think it's really important that we advocate in the mental health community for integrating mental health into broader sustainable development policy, both from a funder's point of view, but also from a country's point of view. I think a lot of that is about improving the way in which we measure population mental health. We've got all these very ambitious targets in the Sustainable Development Goals around reducing poverty and inequality and so on. But unless we measure the mental health impacts of these kinds of interventions, we're not going to really know what is the impact on mental health outcomes. And also I think we're missing a trick in terms of opportunities for intervention. So from a policy perspective, we really need more prominence to be given to mental health and development policy. And I think that's where a lot of this research is leading and hopefully informing.